Good morning.
Good morning, Chairman. We have about 1 minute.
Okay, well, let me know. Thanks.
Thank you. Chairman, we're ready to begin.
Well, thank you, Denisha. And, welcome everybody. And Denisha, would you please call the roll?
Yes, Chairman. I'll begin with Norman Boyd,
Here.
Cynthia Rucker,
Here.
Roger Folsom,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Nelva Lee,
Here.
Shane Mobley,
Here.
Tommy Hopkins,
Here.
Robert Coles. Chairman, that completes my roll call.
Thank you, Denisha. And we do have a quorum, and I appreciate the board members joining this morning and everyone listening in here for a special conference call meeting today, necessitated by a couple of subjects, two different subjects that we need to address, and those being for initial adoption will be asked to vote on. We do have, as I say, we do have a quorum to conduct business. And with that, I will turn it over to Commissioner Carlson for his comments.
Thank you, Mr. Chairman, members of the board, and all of you watching at home today. Again, thank you for joining us on relatively short notice for this called meeting. I'll be brief in my remarks so we can get to the business at hand, but there are a couple of items that I do feel I should make everyone aware of. And it should also be stated that next month's board meeting, July 11th, will be somewhat of a full agenda too, Denisha, as we're all of our teams are working through promulgating rules and regulations for legislative matters, times that still kind of working through some year-end things and just a lot of items that have come our way. And one of those, the robust CON bill that we referred to in the last board meeting. Within that, there's a creation of a comprehensive health coverage commission. And that commission just had its chair named last week. No stranger to this group, former DCH commissioner and current president and CEO of the Georgia Hospital Association, Kaylee Noggle, was named by Governor Kemp to serve as its chair. And as many of you probably know, this department, DCH, is charged per the bill with being the attached administrative support for that commission. So that will be a significant project that we focus on throughout the fall and the summer, late summer and fall. I saw last week that Speaker Burns has named the House's representatives, and I'm sure the Senate and everyone else involved will be filling out the composition of that commission in the days ahead. And we'll begin working through some organizational meetings and get information out as soon as possible. But obviously, President Noggle and myself had a good lengthy conversation last week after our appointment, just to kind of go through some broad thoughts. And we'll be getting to brainstorm in conjunction with the governor's office, House and Senate on those matters, that schedule and those agenda items. So just wanted you all aware of that. And again, speaking of the CON bill, I know summer schedules can be crazy. If you did not get a chance to watch the board meeting earlier this month, Jesse Cox with Health Planning gave a great presentation on some of the X's and O's, if you will, of the changes to CON and health planning created by the legislative efforts this past session. So there'll be several things in place on June 30th that may look different July 1st. Timelines, paperwork, processes. So as always, our meetings and presentations are archived. If you do have, you yourself have an interest in health planning, or you have clients, you represent those that do, I would ask that you look back at Jesse's presentation to give you a little direction as far as how to get some of your initiatives taken care of with the department and those spaces. And the last item I'll just mention, Mr. Chairman, before we move to the agenda, I would like to congratulate two of the rising leaders in our organization, Michael Smith and Cole Edwards, for graduating from the Georgia 2 Academy earlier this month. This is an advanced 9-month challenging curriculum that culminates in a capstone and a research project and presentation. Michael, who serves as our Director of Behavioral Health, presented his work on trauma-informed care guide at the graduation on June 7th. And Cole, who serves as a program operations specialist at our office, State Office of Rural Health in Cordele, he presented on analyzing access and innovative initiatives for prenatal care in Georgia. So obviously the behavioral space and prenatal care are two items of importance to this department, to the governor and the legislature, and to so many stakeholders out there. So thank them both for the professional development, the intellectual pursuit of working to be a thought leader in these important spaces. And thank you to the teams that supported them while they did that. So I know it's intended to be a pretty short, sweet meeting today. So with that, Mr. Chairman, I'll conclude my comments and hand it back over to you. Thank you.
Thank you, Commissioner. Are there any questions, comments for the Commissioner from the board, please? Hearing none, we will move into the first of two agenda items, and both items will be presented by Brian Lipton, Director of Strategic Finance. So, Brian, you may proceed.
Thank you, Mr. Chairman, and good morning to you and to the members of the board. Also, Commissioner and Janisha, thank you. The first item I'm about to present is ultimately $5.9 million in payments to providers that we were already planning to make that have been in the contract all year. We are just changing the payment mechanism through which they are delivered based on some CMS guidance. We were also explicitly told by CMS that in order to make this change, we had to submit to them by the end of the fiscal year, which is going to be on Sunday, June 30th. So that short timeline is ultimately why, ultimately was necessitated this special called board meeting. So thank you again for meeting today and for considering this item. And I'll now go into the formal presentation. So pending CMS approval, a new state-directed payment program will be implemented effective retroactively to July 1st, 2023 for the Georgia Families 360, also known as GF 360. GF 360 is Georgia's managed care program for children, youth, and young adults in foster care, children and youth receiving adoption assistance, and select youth involved in the juvenile justice system. The Care Management Organization contract for GF 360 annually funded a value-based payment program through a 5% withhold arrangement that focused on value rather than volume to accomplish certain initiatives, measures, and certain initiatives measured in terms of outcomes, quality of care, and other factors. CMS notified the department that the current withhold arrangement is no longer permissible, but the state fiscal year 2024 capitation rates would also require an adjustment in the absence of this withhold. Restructuring the arrangement as a DPP was one of the recommended options from CMS that would allow DCH to use the current rates through the end of the fiscal year. The Quality Initiatives and Care for Kids, also called QUIC DPP, will provide funding to specific providers serving GF 360 members to incentivize the delivery of high-quality care. This DPP will transition GF 360 from the VBP, value-based program, by utilizing half of the 5% withhold arrangement to a capitation rate increase as directed in the directed payment program preprint documentation. Accordingly, the existing GF 360 withhold arrangement will be reduced from 5% to 2.5%. There is no projected additional cost as the DPP amount will be offset by the reduction to the GF 360 withhold arrangement. Also, at the direction of CMS, the withhold arrangement will be removed from GF 360 starting in state fiscal year 2025. This QUIC DPP is intended to be a one-year solution only for SFY 2024, and there are no plans to renew in future years. An opportunity for public comment will be held on June 26, 2024 at 11 a.m. via Zoom. Individuals wishing to comment in writing on any of the proposed changes should do so on or before July 3rd, 2024. And with that, Mr. Chairman, I will respectfully ask for the board's favorable consideration of this item for initial adoption, and I'm happy to take any questions.
Any questions, comments from the board, please? Thank you, Brian. And with that, is there a motion for approval for initial adoption?
Motion for approval, Cynthia Rocker.
Second Hopkins.
And Dr. Hopkins has second, and Cynthia Rucker has made the motion for approval initial adoption. All in favor say aye.
Aye.
Opposed? Abstaining? It is approved. Brian, thank you very much, and you may move to your next item. Thank you.
Thank you, Mr. Chair. This next item is on the special agenda in an effort to preserve a July 1st effective date. With that being said, pending CMS approval, the Department of Community Health proposes a revision to the allocation methodology to the Disproportionate Share Hospital DSH program, effective July 1st, 2024. Eligible hospitals in Pool 2 that are classified as Rural Referral Centers, RRCs, by CMS, and that are not eligible to participate in the Advancing Innovation to Deliver Equity, AID, or Strengthening the Reinvestment of a Necessary Workforce in Georgia, STRONG, state-directed payment programs, will receive an allocation no less than 25% of their hospital-specific DSH limit. Rural referral centers are high-volume acute care rural hospitals that treat a large number of complicated cases per CMS definition. Over the past several years, DCH has developed 5 state-directed payment programs that are designed to work in concert with each other and with DSH payments to provide significant benefit to Georgia providers. The shared project goals include supporting rural hospitals and bolstering rural access to care, and these proposed changes aim to support that goal. There is no change to the current methodology for eligible Pool 2 hospitals that are not classified as RRCs. Due to the DSH payments for RRCs being calculated differently from the remainder of Pool 2 hospitals, there will now be 2 allocation methodologies in Pool 2. Methodology A, which begins by calculating the 25% minimum payment, will apply to eligible RRCs, and methodology B will apply to all other eligible DSH Pool 2 hospitals. There is no change to the amount of funds available for DSH payments. This proposal only changes the distribution of DSH funds. The amount of funds available for DSH payments will be determined based on the state's federal Medicaid DSH allotment and require state matching contribution. The state share of DSH payments for state governmental and non-state governmental hospitals will come from intergovernmental transfer made on behalf or by the hospital. Additionally, the Pool 1 definition in DSH will be updated to include eligible critical access hospitals and rural hospitals with less than 100 beds. This removes eligibility for state-owned and operated acute care hospitals because presently there are no hospitals in the state that meet that definition. An opportunity for public comment will be held on June 26, 2024 at 1 p.m. via Zoom. Individuals wishing to comment in writing on any of the proposed changes should do so on or before July 3rd, 2024. And with that, Mr. Chairman, I will again ask for the board's favorable consideration of this item for initial adoption. I'm glad to take any questions.
Any questions, comments from the board, please, for Brian? Hearing none, is there a motion for approval for initial adoption?
Folsom, motion for approval, Mr. Chairman.
Roger Folsom has made the motion for approval. Is there a second?
Dr. Lee seconds.
Dr. Lee has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, thank you so much.
Thank you.
Thank you. I'd like to thank the board members for taking the time for attending today for this brief call and necessary call to meet our deadlines on a couple of important issues here. So with that, is there anyone in the board that knows of any new business that needs to come before the board at this time? Hearing none, we are adjourned, and thank you very much for taking the time today. We'll see you at the next meeting, July 11th. Thank you.
Thank you.